Hi, this is Brooke Lounsbury, registered nurse and expert contributor at CaringVillage. Each week I answer your questions about caregiving and offer tips and solutions. Medical disclaimer: although I am a nurse by profession, I am not your nurse. All content and information shared is for informational purposes and educational purposes only. It does not constitute medical advice and does not establish any kind of patient-client relationship. Always consult a professional who is aware of all the facts and circumstances of your individual situation before making any changes or decisions about your health or well-being. Today's question comes from Sherry.
My father was diagnosed diabetic about a year ago. Ever since then, he doesn't seem to take having diabetes seriously. He won't take his blood sugars consistently, saying he feels fine and that it's a bother. I have repeatedly tried to get him to realize how important it is to take diabetes seriously and take his blood sugar on a regular basis. I can't seem to get it through his head how important it is. He says he really doesn't like having to poke himself throughout the day, and I don't blame him. Any advice?
Managing glucose levels will prevent some of the most damaging health effects of poor glucose control. Some of these include an increased risk for infections such as skin and urinary tract infections, neuropathy of extremities, retinal neuropathy, which is neuropathy of the eyes, kidney disease, and even could put your father at a higher risk of developing Alzheimer's disease. High blood glucose levels aren't the only danger. Low glucose readings can be even more dangerous, leading to dizziness, hunger, seizures, sweating, irritability, and in some cases, even death. Regular blood sugar monitoring is a cornerstone of diabetic management. It provides real-time feedback on how well the plan is working and helps in making informed decisions about diet, exercise, and medication. For example, if blood sugar levels are consistently high after meals, it may indicate the need for dietary adjustments or medication changes. Similarly, identifying low blood sugar episodes can help prevent hypoglycemia, which is low blood sugar, which can be dangerous if not addressed promptly. Consistency helps in reducing the risk of long-term complications such as cardiovascular disease, the neuropathy that we talked about, and retinopathy, and can lower the risk for those infections. There are several devices and methods that are available for monitoring blood sugar levels, each with their own advantages and limitations. One of these may help your father be more compliant with his blood sugar monitoring. Since your dad isn't a fan of blood glucose meters, I have some other suggestions that might help. The first one is called a continuous glucose monitor, or a CGM. CGMs are advanced devices that measure glucose levels continuously throughout the day and night using a sensor inserted under the skin. The sensor transmits data to a receiver or a smartphone, providing real-time glucose readings and trends. CGMs are beneficial for individuals who require frequent monitoring, such as those with type 1 diabetes or those on intensive insulin therapy. They help in detecting glucose fluctuations and trends that may be missed with a traditional blood glucose meter. Now, the one I think your dad might like is similar to the CGM, which is a flash glucose monitor. This one uses a sensor to measure glucose levels. However, they require the user to scan the sensor with the reader or smartphone to obtain the readings. Flash monitors provide a convenient alternative to those, like your father, who prefer to not perform frequent finger pricks. Now, I have a couple of articles that we have on our CaringVillage website that might be help, and your father might even like to read these. The first one is the top 4 ranked diabetes management apps, and the other one is really one that I think both of you should read, and that's How to Manage Diabetes as an Aging Adult. Regular blood sugar monitoring is a vital component of effective diabetes management. It can help your father to take control of his health by providing valuable insights into glucose levels and the impact of his management strategies. By utilizing the available monitoring devices and working closely with healthcare providers, he can achieve a better glycemic control and reduce the risk of complications associated with diabetes. If you have a caregiving question or concern, please submit your questions by leaving a comment below or fill out our form at www.caringvillage.com/questions. I look forward to hearing from you. Until next week.